I am Nancy. I'm going to be changing this IV bag, putting a new bag in, and then also hanging a piggyback. So I'm doing hand hygiene, and I'm checking my MAR, making sure I have the right medication here. I have the 9% sodium chloride, and here is 9% sodium chloride, 125. This is 500 ml, and this right here is 500 ml by IV at this time with John Jones. So I'm going to take my MAR in here to my patient and introduce myself, tell the patient what I'm doing, what it's for, and telling them I'm just replacing the bag. So I am going to I'm going to make sure that this is closed. I'm going to clamp this. And before I do anything, I'm going to just make sure I'm going to identify John Jones. I'm identifying that, so that's a good check. And I'm going to put on some gloves. And then my final check, John Jones, sodium chloride, 9%, 500 ml at this time with IV. That's good. So I'm going to take this off. And this is going to go in. I'm going to put this here. It'll be in this. I'm going to put it in the garbage. So I'm going to put it over there. Take off my cap and then puncture this. And then I'm going to hang this up here. Get my drip chamber half full. There we go. And the drip rate, I have to figure that out and make sure that this is going. And, you know, before I even do this, I'm checking the site, the injection site, and making sure that there's no redness, making sure that there's no edema, there's no coolness, or no hot or heat. It all looks really good. And now I'm going to check my second medication, which is the piggyback, sodium chloride, 50 ml. Let's see here. Sodium. Yes, okay. Right here, sodium chloride, 50 ml for John Jones at this time, and the piggyback. So here is my secondary tubing set. Okay. And before I puncture this, I want to make sure that this is sodium chloride for John Jones at this time, 50 ml, and by IV. So I'm going to take this off, take this off, and before I purge the line, prime the line, I want to do my final check. This is sodium chloride for John Jones. Yep, at this time, 50 ml. Okay. Now, I want to prime the lines, nor did I want to make sure I take this cap off. And just slowly have it drip through so that I get rid of all the air bubbles. Okay, there we go. Good. Now I'm going to hang this up here, and alcohol wipe. I'm going to choose the port that's closest to the piggyback. Okay. Make sure that's in, and I'm going to open the my main line is open all the way, and I'm opening, let me do the drip chamber here, make sure it's up to the midline there. And I have calculated my drip rate to be 40 drops per minute. So I would check my drop rate, I would count the drops per minute, and then set my drop rate. And then with this, I would also attach a tag that says my initials and when the tube, well, this tube isn't going to be changed. This is going to be done in 15 minutes. So I would put my name on that and make sure the patient's at the lower, his bed is down low, bed rail is up, call light is on, and and I would document that I did that. And that is the end of my changing IVs.